In the operating room, everything is calculated in seconds. Every instrument on the table is an extension of the surgeon's hand. Here are the most commonly used surgical instruments. The scalpel, the most fundamental instrument of surgery. This is the number 3 handle and number 15 blade. Ideal for precise, fine incisions. The first cut begins with this instrument. Straight scissors. Primarily used to cut sutures after wound closure. The tips are blunt, so they do not damage the tissue. Medicine-bound scissors, used to separate delicate and soft tissues. Thanks to their long shanks, they work comfortably in deep wounds. Anatomical forceps. They have fine serrations on the tip but no teeth. Ideal for grasping tissue without crushing or damaging it. Surgical forceps, they have teeth called mouse teeth. Used when a stronger, more traumatic grip is required, for example, when suturing skin. Adson forceps, widely used in plastic and neurosurgery. They are fine and precise. They grip small tissues perfectly. DeBakey forceps, indispensable in vascular surgery. The wide serrations at the tip grip the vessel wall without crushing it. Straight mosquito clamp. The smallest hemostatic instrument for grasping small blood vessels. Very fine and precise. Curved mosquito clamp. Same size, but the curved tip makes it easy to work in narrow spaces, for example, deep in the pelvis. Kelly clamp. For medium-sized vessels and tissues. Stronger than the mosquito, but toothless. Cocker clamp, holds tissue firmly with teeth at the tip. Used to secure thick fascia or heavy tissues. Mayo-Heger needle holder. Firmly grips the needle to close the wound. Every stitch is placed with this instrument. Farabuff retractor. A handheld wound retractor. Its flat and curved shape retracts tissue without damaging it. Whiteliner retractor, a self-retaining wound retractor. The toothed tips open the wound and free the surgeon's hands. The bipolar electrocautery, one of the most essential hemostasis tools in modern surgery. High-frequency electrical current passes between the two tips of this forceps. Because the current is confined to the two tips, surrounding tissues remain unharmed. Ideal for sealing small blood vessels, cutting tissue, or stopping bleeding. Widely used in neurosurgery, plastic surgery, and general surgery. Precise, safe, and minimally invasive. Monopolar electrocautery, used for broader cutting and bleeding control. The current passes from the instrument to a grounding pad placed under the patient. Widely used in major abdominal surgeries and orthopedics. However, because it affects surrounding tissues, it requires more careful use than bipolar. The aspirator, a surgical suction device. It clears blood, fluid, and irrigation from the operative field, giving the surgeon a clean view. This is the Yankauer tip, broad and blunt, it removes fluid without damaging tissue. For deeper, narrower fields, the metal Fraser tip is used. Without visualization, there is no surgery. The aspirator works every second. In the operating room, every instrument has a purpose. Subscribe for more surgical content. Press the button now.